So hello friends, a very good evening. Hello, am I audible to you? And my picture is clear? Yeah. So good evening and welcome to our YouTube channel at Unacademy. Friends, I am Dr. Shivani Jain, your NEET PG educator at Unacademy. I am MS Ophthalmology from UCMS Delhi, and Ophthalmology Notes is the book which I authored. So friends, we can be connected at various platforms like at my Facebook group, which is on the name of In Focus Ophthalmology by Dr. Shivani, and there's a Telegram group with the same name. So friends, at Unacademy, if you have your Plus subscriptions, you will be having access to all the live sessions which we are conducting daily. And there you will get all the structured course. Live tests and quizzes will always be there for you, and the best part is the unlimited access. Now friends, we are having intensive revision batch course which is ongoing these days, that began on December 7 and will be continued till January 7th of next year. So friends, that will be your final revision batch, which includes all the image based question, previous year questions and the most probable questions. So I also took some sessions in this particular batch. You can go through my videos if you haven't accessed it yet. Similarly, we have a target FMG batch that will begin on 28th of December, guys. So you can enroll now and can get the maximum advantage from this batch. Now in ophthalmology, we will be conducting a 20 hours comprehensive course where you can do all revision, all important topics will be covered. Also, we have a target next 2020 batch which we are conducting nowadays, and that's your morning batch. Everything will be covered comprehensively. All the subject matter educators will be there, and that will help you in your learning. So doubt clearing sessions will also be there, guys. So you can also use the code SHIVIJ to unlock the Unacademy free plan, friends. And there's no need to wait. You just download the Unacademy learning app on your mobiles and get set go. So good evening all of you. Good evening. So today we will be having a short discussion on two important topics in optics. First is the Sturm's Conoid, and we will have a discussion on this Duochrome test, which I think can be there in your exam this year. Now friends, what is Sturm's Conoid? What is the need? What is the optics behind it? Why do we need this in ophthalmology? That we are going to talk about in brief. Now, you know, in normal subjects, what happens that parallel rays of light are entering and they are converging to a point focus at retina, isn't it? This happens in emetropia. So what do we have? In emetropia, the parallel rays of light are coming. They are focusing to one point of focus in retina, and that is mostly at the fovea. So we get the best of the vision, isn't it? That is the normal thing. But what if you have an astigmatism? So when you have an astigmatism, you have two focal points on retina, isn't it? Either you have multiple foci or you have two focal points on retina which are perpendicular to each other. Okay, so this is about your astigmatism. So what happens when light rays are traveling through a astigmatic surface or a toric surface? That optics is described through Sturm's conoid, right? So what is the optics? So when you have a astigmatic surface where the dimensions at the vertical meridian is different from the horizontal meridian, what happens? Let us see. So let us take an example of cornea where your vertical meridian is steeper as compared to your horizontal meridian. Okay, so that is with the rule type of astigmatism. This happens in most of us. Okay, so vertical, no, it is not very dangerous. it's a little tricky, not dangerous, Dr. Tarun. So here vertical meridian is slightly steeper than the horizontal meridian. In other words, you can say horizontal meridian is flat, right? So what happens when light rays are going through a astigmatic surface, through a toric surface, right? Now let's see in the picture. Here friends, we have a astigmatic surface. This is your vertical meridian. This is your vertical meridian. This is your horizontal meridian, and the dimensions are different, right? Now, when the light rays are going, you can see there is convergence, isn't it? There is a convergence on both the vertical and the horizontal meridian, right? Now, what happens at point number A? If you can see, this is your point number A, So what is happening at point number A? Both the light rays are getting converged, isn't it? Vertical meridian is converging, horizontal meridian is also converging. So as a resulting figure, as a resulting image, you see a horizontal oval. Is that clear? Because both of the rays are convergent, vertical and horizontal, the final image is a horizontal ovoid. Now what happens at point B? So this is your point B, friends. Please see, at point number B, your vertical rays are focusing. Your vertical rays are not convergent, not divergent, but they are focused. Okay. So what if vertical rays are focused? So you only get a horizontal line, right? So here at point number B, your vertical rays are convergent. Your horizontal rays are still converging. So you have a horizontal line as a final image. Now see what is happening at point number C. This is your point number C. So friends, after convergence, the vertical rays again starts becoming divergent. Please see, initially they were converging, they converged to a point, and after this forming the image, they again becomes divergent. So here at this point, your vertical rays are convergent and your horizontal rays are divergent, and your horizontal rays are still converging. But at this particular time, the divergence produced by the vertical rays are absolutely equal to the convergence produced by the horizontal meridian. Okay, so your vertical divergence is equal to the horizontal convergence. So the final image at retina would be the circle. That will be absolutely a circle. Okay, so what happens at the next point? So point number D, what is happening, friends? Vertical divergence is more. Vertical is diverging and your horizontal is still converging. And you can see that the divergence produced by the vertical rays is slightly more than the convergence produced by the horizontal rays, isn't it? So you get a vertical oval kind of structure, right? Now what happens at the next point? This is the point number E. So at point number E, your horizontal rays are getting absolutely convergent. See, Dr. Tarun, the rays are still going on. We are taking different points. Okay, once they are convergent, so they have to diverge again, right? You have a continuous number of points. We have multiple number of points we are taking. So this is how it happens. Now at point number E, your horizontal rays are getting convergent and your vertical rays are still diverging. So what you get? You get just a vertical line because there is no refraction by the horizontal rays. Now what happens? At point number F, both the rays becomes divergent. Vertical is divergent, horizontal is divergent. So as a result, you get a big one, you get a vertical ovoid. Right. Now what is the clinical implication? Why are we studying that? We are studying, guys, because we want to know what happens in a patient who has astigmatism and where should we give the patient the best possible correction. Now that means, suppose we want to give a patient a spectacle which has a cylindrical power. So at which point we should be giving the power? So we want that the power should be somewhere in between these two foci. Okay, so this is called as your focal interval of Sturm. That means if the image is formed anywhere between focus 1 and 2, it will be a good quality image, right? It will be a good quality image. And if the image is formed at the circle of diffusion, the least diffusion, this image will be the best image. Okay, it means that if the distance of that glass from the retina, that means if the image is forming at that particular point at the circle of least diffusion, that image will be the clearest image, the best possible image. Okay, so what about the questions? So they can give you a picture of Sturm conoid in your exam, and they can ask you what will be the image at point number B, point number C, point number D, and so on. Okay, so this can vary. In your exam you can have different pictures. It's not always that at point B you get a horizontal line, or at point C you have the circle of least diffusion. This picture can vary. Okay, so you have to select at which point your vertical divergence is equal to the horizontal convergence. You have to find out that particular point. So that particular point will be having the circle of least diffusion. Okay, so that can be your question in the exam. They'll just give you a picture of Sturm's conoid and they'll ask you what if, or what will be the type of image at point B. And at point B you have to see whether the convergence of vertical rays is more or the divergence of horizontal rays is more, and so on. Alright, I hope you have understood this now. What is the optics behind Sturm's conoid, why we are doing this, and what is the clinical implication. Okay, clear? Any questions, any doubt now? So it keeps on going. Okay, definitely we'll be having some questions. We'll have a NEET pattern day after tomorrow. Next we will have some questions on glaucoma. Definitely tomorrow we will be having a discussion on some pictures. Okay, tomorrow you can attend again. Now the next one is duochrome test, guys. This is a very important expected question. Now the word duo suggests two, double, two. Chrome means color, so it means a test where we utilize two colors. Now why do we do that? We are doing that because we want to find out the best possible spherical correction. Okay, best possible spherical correction. Now guys, what happens in day-to-day life? We have a chromatic aberration in the eye. Chromatic aberration means that when white light is going through the eye, light splits into 7 colors and the green and blue spectrum are focused relatively in front of retina and the red light goes behind the eye. So it is basically the yellow color, the yellow light which is focused on the retina, the best. Okay, so this happens in normal individuals, right? Yellow light is focused the best, green slightly in front, red behind the eye. Okay, so this is with normal individuals. Now what is the basis of the duochrome test? The basis is the same. Green color is focused in front, yellow light is best focused at retina, and red is slightly behind. Now how do we do the procedure? What is the procedure? Let me explain. So after we have given, suppose I have given a power of +2 diopter sphere to my patient, suppose. Okay, for an example, I think that my patient has a power of +2 diopter sphere in both the eyes. Now I'll ask the patient to look through this +2 power glass and to look at these two lights. These two colors are actually placed within the slit lamp. Okay, so beneath the slit lamp we have a strip where we have red and green colors. Okay, so we ask the patient to look at these two colors and ask the patient whether green appears brighter, more clearer, or red is brighter or clearer. Okay, so this is the question we ask the patient. Now if the patient says that he sees green color better, he sees green color brighter or sharper or better, that means he is having a hyperopia. Hyperopia means that you have to add a plus 0.25 diopters in him. Now, what is the optics? So, if he sees green better, that means green light is focused at the retina. Can you see? Green light is focused at the retina. That means it should not be there in emetropic settings. In emetropes, your yellow light should be focused at retina. So, how in this case yellow light will come to focus? If we place a more convergent lens, that means if you place a converging lens, the light rays will be focused in front. Okay, this is the simple optics. If green color is appreciated better by the patient, that means you have to add more plus to your power. Okay. No definite thing. It is not same as the Worth 4 dot test. It is absolutely different. Worth 4 dot test is to check for binocularity, binocular single vision, any problem related to binocularity like suppression, abnormal retinal correspondence or what. This is a test where we check whether the spherical correction we have given to the patient is absolutely okay, or we have overcorrected him, or we have undercorrected him. Okay, so let me show you with an example. So suppose I told you that I have given a patient plus 2 diopter sphere power. Now I want to check whether the actual power should be plus 1.75 or it should be plus 2.25 diopter sphere. I want to check whether this is okay or this is okay or this should be the value. So if the patient with a plus 2 diopter sphere says that I can see equal brightness of red and green colors, that means my prescription is absolutely okay, right? Now, if the patient says that he sees green color better, that means he should be given plus 2.5 in an addition. So what should be his power? His power should be plus 2.25. Okay? Now, on the other hand, if the patient says that he sees red color better, that means red light is focused on the retina. Obviously, if he sees red color better, the red light is focusing at fovea. Now, this should not happen. ऐसा तो नहीं होना चाहिए ना? क्या होना चाहिए in the normal settings? What should happen? The yellow light should be focused on retina. So, how will yellow light come to focus at retina? When this will be pushed behind. So how will that be pushed behind? If I place a diverging lens, if I place a concave lens. Okay, so concave lens means that I have to undercorrect that. Okay, so this is your, yes, so this is your ideal situation when the patient should see red and green color in equal brightness. Okay, so red color if the patient sees, then you decrease your spherical correction by 0.25 and then plus 1.75 diopter sphere will be your final correction. Now have you understood? Have you understood, guys? Okay, so this is the basis of duochrome test. I am quickly revising with you. The basis is that chromatic aberration is present in everybody's eye, in which the green light are focused little bit in front, red is focused little bit behind. Yellow light should be focused at the retina. This should be the ideal scenario. So, when I want to refine my spherical correction, when I want to refine my sphere, not cylinder. So, when I want to refine my spherical correction, I ask my patient to look with this power whether he can see green and red as equal brightness, equal clarity. If yes, my 2 diopter prescription is okay. But if he says that he sees green better, that means you have to add. Okay, so the prescription will be plus 2.25. If still he says I can see green better, add more. Add more. If he says still more, still better, then you can add more till the time he sees equal brightness. Okay, now one very important thing, you can learn the mnemonic as well, gap. So green needs more plus class. Okay, you can remember with this mnemonic, green add plus. If you learn this mnemonic, this is very, yes, this is only for spherical power. Okay? It is not related to your cylindrical value. For cylinders, you have Jackson's cross cylinder. Okay, you have Jackson's cross cylinder or your astigmatic fan. But this is mainly for your spherical correction. Okay, please remember this mnemonic gap. This will help you in solving your questions. Right? Defect. You can find the defect by doing, see, Dr. Ajay, you can find the actual defect by doing the retinoscopy, but sometimes what happens, we actually have to refine. Okay, when you do it objectively through retinoscopy, you have to do a subjective test, isn't it? Subjective means what the patient says. So you must do a refinement of your retinoscopic findings. Okay? So for that refinement process, you can use this test. Okay, not every day we are using that, you know, it is very important theoretically. Practically not many people are doing this test. Okay, is that clear? So this is the mnemonic, guys, gap, which you can use very easily. You can learn how to answer. Green color better, that means you have to add plus more. Okay, so that is all for now, guys, today. Tomorrow you can attend again, yes, just for refinement. Yes. So what can be there in your question? They can give you the picture. They can ask you first of all, what is this? What is this test? So many students will get confused. This is type of Worth 4-dot test or what? Because you are showing colors. Okay, but please remember this is a new test. If you can learn this, that will help you. So tomorrow, guys, we will be having some picture question discussion on the anterior segment OCTs, the principal and the UBM. So stay connected. Tomorrow morning we will be having a session at 10:30 a.m. Okay, I'll show you some images and I'll ask you some quick questions about ultrasound and these two things. Okay, so thank you very much for attending. Have a nice